Everyone, welcome. My name is Jana. I'm a registered nurse and I work for the Institute for Safe Medication Practices.
Hi, all. My name is Jen, and I am a pharmacist that works with ISMP.
Our organization, we've been around for over 30 years, and our mission is to advance patient safety worldwide by empowering the healthcare community to prevent medication errors. Today, we're going to talk about GLP-1 receptor agonists, which they've been getting a lot of attention recently, medications like semaglutide and tirzepatide. Their primary use is for diabetes and obesity. Today, we're not going to talk about who should be taking these medications, but just about how people who are taking these should be able to use them safely.
Yeah, there's been an actual really rapid rise in demand. And as a consequence of this, we've also seen some subsequent shortages, which has led to a surge in compounded formulations, which are unregulated sources. And this can definitely increase the risk of those dosing errors. In fact, the FDA has received over 1,000 adverse events that have been related to compounded GLP-1s. And at ISMP, we've also received reported errors that have been related to the use of manufacturer-made GLP-1s.
Yeah, so we're going to spend some time talking about those errors, but before that, let's just level set and see how big is this problem? Who's taking these types of medications? Really, it's hard to know for sure how many people are taking them because the use is so widespread in both brand name and compounded formulations. We found one analysis done by the CDC that estimated a little over a quarter of people with diagnosed diabetes are taking GLP-1s. And there's really wasn't a significant difference between men and women within that population. But they did see a slightly higher use among Hispanic, Black, and non-Hispanic white adults compared to Asian non-Hispanic adults. One big reason why we see people taking these or not, a big factor is socioeconomic reasons and insurance coverages. So GLP-1s can cost hundreds of dollars a month. And without insurance, some patients decide that they either cannot take those medications or they need to take them through a compounding pharmacy to get a cheaper price. One study found that for every 1% increase in out-of-pocket cost, the odds of discontinuation increased, which makes sense, right? In other words, the more expensive the medication is out of pocket, the less likely people are to stay on it.
Yeah, for sure. And I think it's also important to acknowledge up front that GLP-1 medications come with some commonly reported side effects as well, especially the gastrointestinal or the stomach upset issues. And this can be pretty uncomfortable for some, even severe enough to require closer attention or to maybe even discontinue the therapy. But what makes this discussion compelling is despite those side effects, the longer term impact on morbidity and mortality might be promising. And the evidence from ongoing studies continues to grow. According to one analysis, GLP-1s could reduce all-cause mortality in the United States by 6.4% over the next 20 years. So in practical terms, that's a significant decrease in the likelihood of death for adults over the next 2 decades. We also know from contemporary clinical trials that medications indicated to treat obesity, which include GLP-1s, can lead to weight loss that ranges anywhere from 5 to 22.5% when combined with lifestyle modifications. So even a small percentage of weight loss in obese patients can have a meaningful impact on both physical function and comorbidities, such as improving cardiovascular health and lowering blood pressure. So, a key takeaway is that while side effects should not be overlooked, the potential for GLP-1s to improve health outcomes, especially over long term, is exciting. And as more data comes in, we'll get an even clearer picture of how these medicines can help patients living with obesity and diabetes.
Wow, thanks, Jen. That's exciting. I'm excited to see as more science comes out, more results comes out where this is heading. So we want to make some common errors known to you all. We at ISMP have errors reported to us, and we use those to analyze and get the word out to try to see if we can prevent these from happening to other people. So one issue that we've had, what we've heard of from a lot of people, is making sure they get the correct dose. One of the reasons why this happens is that people get their dose and it's ordered in milligrams, and they're taking their medication from a vial and drawing up the medication into a syringe, and that syringe is labeled in units. And patients are getting confused between milligrams and units and how much they're supposed to be taking. And unfortunately, this has resulted in two things. One is that it's resulted in underdosing, so people aren't getting the amount of medication that they're really meant to get. And then the other side of that is they're getting too much medication and they're overdosing. And that one has actually resulted in hospitalization for people because the side effects have been so strong that they've needed to go in to get help. So we really want to make sure people get the right dose of the medication that's intended for them.
Yeah, 100%. That can be a scary outcome for some folks. And in addition, ISMP has received additional other types of reports of dosing errors. And some of the others are often related to patients receiving the incorrect dose dispensed by the pharmacy. So oftentimes these mistakes happen because the doses are frequently changed. You might be on one dose 1 month, then it changes to the next dose the next month. And patients are inadvertently receiving either too high or too low of doses because of those particular errors as well.
Oh, great point. And along those same lines, we have other patients who take the multi-dose pens, and it's really important to make sure that as if people are using those pens that you have to click to get the intended dose that was correctly outlined by your provider. So we really encourage that if the use of counting clicks or splitting doses can lead to errors. So we just want to caution that when you get your dose, when you get your medication from your pharmacy, to make sure you've got the right dose that's intended for you.
Great point, Jana. Another issue that has been reported to ISMP that relates to patients actually saving extra medication from single dose vials in order to extend the use of medications, maybe to save the extra injection for a later time. And it's really important that patients understand that if a vial is labeled by the manufacturer as a single dose vial, it means that it does not contain ingredients, which might also be known as an antimicrobial preservative, that protect it from bacteria growing in the vial once it's been punctured. So, therefore, even if there is medicine still left in that vial, you don't want to save it to use it again because bacteria can begin to grow even within 1 hour of puncturing the vial, which makes that second dose of medicine really unsafe. So use that vial for a second dose can result in infection, and we don't want to do that. So we want to make sure that even if it's used for the same person at a later time, we want to throw that away and not use it again.
Yeah, great point. The last error that we want to share is related to education that's provided to patients. And there's been a few different examples, but one of them is related to the education around what to eat and how to eat so that to decrease the side effects. And we had one set of patient instructions that was submitted to us that the healthcare provider was instructing a patient to eat 6 meals a day, 6 to 8 hours apart. And so the patient was confused. What does this even mean? How many days, how many hours are in a day, and how do I eat the right amount? And so, if you're a patient and you're reading your instructions and things don't make sense, stop the line and ask your provider to explain what they mean, what they intend. With these types of medications, we really need you to understand your plan of care and be able to take these medications safely. Another area that we need patients to be educated on is around the risk of counterfeit medications or substandard medications. So here's an example of a medication that was sent to a patient. And in this example, a patient self-injected these medications and ended up getting hospitalized due to side effects and likely overdose. But notice in these pictures, the spelling errors on the packaging, the lack of clear instructions, the lack of labeling. These are all signs of a substandard or counterfeit medication. And the ER where this patient went helped to identify this. And so as we as ISMP, we learned about this, we've identified that more people need to know, especially as they're ordering these medications online and from potentially risky sources. So we want you to be able to identify these risks and stop. Do not take these medications, especially if they show signs of being counterfeit. So really thank you for being here and listening to us today. We're excited about the growth and opportunities with GLP-1 medications, but we want to make sure that if you're taking them or if you're a family member or you're a healthcare provider caring for people taking GLP-1s, that they're getting the right dose and they're able to take them safely.
Absolutely. And remember that there are actually videos on the drug manufacturers' websites that can help you learn how to self-inject. And you can also request to do a demonstration of your injection with your physician, a nurse practitioner, or pharmacist.
Great point. And check out the resources that we have in the description for more information. We encourage you, if you have an error or if you see a risky situation, please report it to ISMP. It helps us learn and it helps us get the word out for more people. So thanks to everyone for listening in and stay safe.